Is the inner part of your elbow causing you pain, nagging discomfort every time you pick something up or swing a golf club? You're in the right place. In this video, I'm going to break down everything you need to know about golfer's elbow, what it is, what causes it, and most importantly, the simple steps you could take at home to find relief. Hello, I'm Dr. Craig Salinger, and today we're diving into medial elbow pain. The pain is often due to a condition known as medial epicondylitis, or more commonly, golfer's elbow. Golfer's elbow is when the tendon in the elbow becomes inflamed and painful. This is usually due to a great amount of stress to the flexor muscles in the forearm. This type of tendinitis is typically triggered by repetitive activities involving impact or gripping motions. Think of hammering, typing, pruning with shears, or swinging a golf club. Disclaimer, it's important to note that there are various conditions that can cause elbow pain. It's always a good idea to consult with a healthcare professional for a proper diagnosis and personalized treatment plan. This video is intended for educational purposes only and is not a substitute for professional medical advice. Identifying the cause. The first step to managing golfer's elbow is to identify what is causing the pain. Reflect on your daily activities. Are you doing anything repetitively that could be aggravating your elbow? What makes it hurt? Are there any work activities, sports, or hobbies that make your elbow hurt? Now, let's jump into health tips for treating golfer's elbow. First thing, avoid the aggravating activities. Take a break from doing the activities that severely increase your pain. Avoid the pain generators. Continuous agitation can worsen your condition, making it even more difficult to recover. Next, rest in ice. Apply ice for up to 15 minutes, 2 to 3 times per day. Take a break and rest. Rest your forearm flexor muscles for a few days, allowing time for healing and the reduction of inflammation. Next, stretching exercises. These can be very effective. Try extending your wrist and fingers to stretch the forearm flexors. For a deeper stretch, place your hand on a table, bed, or wall with your fingers either pointing at you or down towards the floor. Hold the stretch for 1 to 2 seconds. Do 1 set of 10 repetitions of these stretches. When you're building up tolerance, you could do this 3 times a day, 1 set of 10 reps. Use of braces and sleeves. Compression sleeves or braces can help to alleviate the pain and make daily activities more manageable. The reason why braces can be helpful can be seen by this example. If this end of the rope was a tendon, this other part of the rope being the muscle, the tendon is attached to the bone and is inflamed. Every time you use the flexor muscle, it pulls on the inflamed tendon, causing more pain and inflammation. The brace pins and compress the area so that there's less pulling on the tendon from the use of the flexor muscles. We want to place this bump part of the brace on the area of pain. Athletic sleeves help to compress the general area around the elbow and arm and are also very helpful. Next, strengthening exercises. Strengthening the forearm muscles can help reduce the pain and help break down adhesions and scar tissue in the muscle and tendons. The first strengthening exercise is a squeezing type of exercise. It's a squeezing or gripping exercise. Take a gel ball, stress ball, or a tennis ball. Gently squeeze the ball, holding it for a second. For even more intense exercise, you can put your wrist into flexion. Bring it up towards you, holding in flexion while you squeeze the ball. This is a tough one, and I would usually recommend this only if after my patients have a week or so of doing these exercises. The second exercise is wrist curls. This can be done with a dumbbell or exercise tubing. Hold the weight or the tubing for about 2 seconds up like this. Make sure to stabilize the arm as well. The third exercise is supination pronation with a hammer. Slowly move the hammer back and forth, back and forth. If the exercise is too difficult, grab the hammer closer to the head. Massage. There are various massage techniques that can help golfer's elbow. You can use the back of a knife with massage cream, gently gliding back and forth over the area of the muscles in the forearm and the area that's sore and the area close to the elbow. Be careful not to press hard. A massage gun can be used on the muscles of the forearm. Again, be gentle. I wouldn't put any pressure or use a massage gun on the bony parts of your arm or elbow. And one of my favorite massage techniques is a pin and stretch technique. Bring your arm up in flexed position. Find the area of pain with the opposite thumb. Push down and gently upward and firmly while you slowly bring your arm down. Then extend your wrist and fingers, bringing the arm into pronation. You can also push firmly with your thumb and traction downward as well and repeat the same process. Do this several times. For my patients, I recommend starting with one set of each exercise, 10 repetitions, twice daily. As you build up tolerance and improve, you can increase to 2 sets of 10, 2 to 3 times per day. Remember, some discomfort is normal, but your pain should not exceed above a 7 out of 10. If you experience the pain more than 30 minutes of pain after the exercise, it's an indication that the intensity is too high and you need to step it back a little bit. Or it could be another underlying condition that's going on other than tendonitis. I will leave a link down in the description area for all the products we use today in our video. They are Amazon affiliate links, which means we may receive a small commission for any purchase of those products. If you found this tips helpful, don't just leave it at that. Hit the like button, subscribe to our channel, and turn on the notifications so you never miss out on any of our latest health tips and home treatments. Also, if you're dealing with a specific condition or you have questions, drop them in the comments below. This helps give us feedback to create content that serves you better. So let's keep the conversation going and work towards a healthier and pain-free life together.